This is Outcomes, a show about uncovering the hundreds of micro-innovations that help make Australia's healthcare system one of the best in the world. On the show, you'll meet the doers, the Australian clinicians, care workers and healthcare professionals driving the micro changes we seek to showcase. Theirs are the stories we're here to tell. I'm your host, Will Egan, and I'm the CEO of AusMed Education. I'm really passionate about improving the health and prosperity of the people in my community. I believe Australia does have a great health system, and every conversation we have on this show highlights why. Today, I'm joined by Leanne Boase, CEO of the Australian College of Nurse Practitioners. Today's show is a little different. The micro changes we discuss actually have a macro impact on the way our healthcare system operates, from how medication legislation is written to the way community health services are accredited. We explore the MS two-step legislation and the corresponding funding change as just one example of this. It's a fascinating conversation, which I'm sure you'll enjoy. We did, unfortunately, have a few issues with audio throughout the show though. We've done our best to edit these out, so thanks for bearing with us, as this content is absolutely not to be missed. Let's jump in. Well, Leanne, welcome to the show.
Thanks for having me.
No worries at all. We're really looking forward to this conversation. I'd love to get you to start by just telling us a little bit about your story and your background. It's quite extensive.
Oh, wow. It's been quite long so far, but I'm a nurse practitioner now, and I'm also the CEO of the Australian College of Nurse Practitioners, which is the professional body for nurse practitioners and advanced practice nurses in Australia. But I started out in let's just call it in the 90s as a registered nurse, and I spend a lot of time testing waters and trying different things and trying to broaden my scope and my interests. And I worked in a lot of different acute sectors, including primary care, and ended up in the bush. And it was really sort of a rural, remote areas where I developed my practice to become a nurse practitioner. So I became a nurse practitioner in 2009. And since then, I've spent a lot of time building clinics for both other people and also for myself to own and operate. So GP clinics, specialist clinics, and now private hospitals. But my current role is the CEO of the Australian College of Nurse Practitioners. And with that role, I've been doing a lot of advocacy work with government. Our advocacy work is not just focused on nurse practitioners, although that is what we consider very, very important. We're also focused on improving healthcare in Australia, and particularly improving access to healthcare.
Listeners know this show is about highlighting the small changes that make Australia's healthcare system better, that lead to better outcomes. But I think this episode is going to be slightly different because the type of change that you're able to affect and have affected is actually more systematic. It's at a regulatory level, it's at a scope and role level, and even it's at a societal level in terms of what we understand as a population to be normal, or the language that we use to describe our health systems. But begin, I think, by just explaining to everybody, what is a nurse practitioner?
I often explain what a nurse practitioner is to nurses and other healthcare professionals. And I'll say, over the years as nurses, as registered nurses, we continue our education, we continually develop and expand our practice. Now it's a matter of the registered nurse is becoming the leader in the healthcare team in many cases, and they're actually able to follow through and start making some of those decisions. So the nurse practitioner is the registered nurse, very experienced, but has that proven track record in advanced clinical decision-making, advanced assessment, and has already shown that they're safe to step up to that next level and start leading some of those healthcare decisions, or in some cases, all of those healthcare decisions, and leading healthcare teams as well. So these are our most advanced nurses. Now, if I talk to a patient or a consumer or a client about it, I would say if you can imagine those nurses that are directing your care, that really understand what's happening, that ask you all the right questions, that is what a nurse practitioner is. But they can now go ahead and they can do a lot more for you. They can use all of their skills and knowledge.
These are people who would be working right across our healthcare system in every different type of service. Is that the case?
Absolutely. There's potential and future nurse practitioners across Australia in many different settings. What we're not good at is always recognising and supporting them well. And this comes back to our main topic, have we maximise the potential of this workforce? No, we haven't. There's plenty of potential nurse practitioners out there.
The role of the nurse practitioner in Australia, is it new, or is this something... When did we have our first nurse practitioner become registered?
Our first nurse practitioner was in the year 2000. Relatively recent, but at the same time to only have around 2,700 in 24 years. When we know the potential pool of nurse practitioners in Australia is much bigger than that. And if you look internationally, the proportion of nurse practitioners to registered nurses in Australia is very low. And also, if you look at it from a population perspective, the proportion of nurse practitioners to population were also very low compared to other countries such as the USA, Canada and the UK. Having said that, there's differences in regulation around the world as well. For instance, in the UK, you don't have to be registered as a nurse practitioner. Anyone can call themselves one. So we do need to be careful when we're looking at data that we are actually looking at the same thing. In Australia, though, regulation of nurse practitioners was set up very well from the very beginning. So they had the foresight to actually protect the title and put standards in for practice, put standards in for the education of nurse practitioners. And those standards have been continually developed as the roles developed in the country. So we did a really good job of setting this up in Australia. The problem is that the healthcare system hasn't adapted, and that's actually stunted the growth of the workforce.
Okay, and that stunting of the growth, does that manifest in ways where nurse practitioners, whilst they may be employed in a health service, aren't actually using the skills or the superpowers that they have as a nurse practitioner in support of that service, aka they're doing, say, the role of a nurse? Is that the limiting factor?
Yeah, we do know there's quite a few nurse practitioners in Australia that are working as registered nurses because their employer isn't prepared to support their work as a nurse practitioner. They're perhaps not prepared to pay them as a nurse practitioner, or they don't understand the role as the nurse practitioner. Or there's other barriers, there's legislative barriers. There's many, many reasons, but we are quite alarmed by some of the data. It's very hard to get accurate data, but some of the data, perhaps up to 20% of nurse practitioners would be an estimate, not working as nurse practitioners.
Do they maintain their registrations despite not working as a nurse practitioner, especially if that's over a sustained period of time?
Yeah, as long as they're working clinically and they're working in advanced practice, so they've got that advanced clinical decision making and they're using their advanced assessment skills, diagnostic skills, then absolutely they maintain their registration. It's not an issue from that perspective, but it is a significant underutilisation of the skills of a health practitioner that can actually deliver a lot in regard to healthcare and improve access. So it's frankly an absolute wasted resource.
It sounds like it. And I used the term superpowers earlier because in my mind that's always what I've thought of a nurse practitioner. They've got all these extra superpowers that they can lean on to provide care for their patients. But is that a good term or is that a bad term?
Well, look, it's not a bad term. It's always nice to think you might have a superpower. But, it's super dedication. A registered nurse to become a nurse practitioner, I mean, there's a lot of work involved. There's a lot of development. There's a lot of commitment. There's a big financial commitment, a huge time commitment. The study is no piece of cake whatsoever. It's extraordinary. So even if you're an RN and you've specialised, when you do your master's, you have to do a generalist master's. So you study advanced assessment across all types of patients, all areas of health, and you study prescribing across that broad context as well. It's a big commitment to your own development, huge financial commitment as well to take the time off at what is usually, your mid-stage of your career where everybody's got families, mortgages. They're taking extraordinary amounts of time to go and do this study. So in many ways, I believe our nurse practitioners have superpowers, because not only the pay as a nurse practitioner is not that great, it's not that much more than a nurse, but we're all doing it to improve healthcare. We're all doing it in the hope that nurse practitioners will be recognised in Australia in the near future for what they can do, what they do. They're doing it to ensure healthcare can be delivered more effectively in Australia, get better outcomes, improve access to care, and to be able to offer more to people as well. So they are super people.
I totally agree. I think definitely super people. And I think the first superpower they clearly have is the determination to improve the healthcare system. But what would be the superpowers once they've achieved their registration as a nurse practitioner? What are the things that they can bring to the table into that multidisciplinary healthcare team that they couldn't before?
But some of the really big contributions are patient education, or teaching people about their health and empowering people to understand their health better, to access, care, or make good decisions about their health in, at the right time, and to individualise care and treatment plans to people, to make sure that what the plan is, it actually suits them, that it's realistic and achievable. That's the nursing focus that we bring, and that is invaluable. It's really, truly person-centred, and people respond incredibly positively to that, and they see the benefits that you're actually partnering in healthcare. You're not directing people on what to do. You're actually in partnership with them and bringing them along in the decision making and factoring in their individualities into their health.
The role of the nurse practitioner then really does systematically open up a whole lot of other possibilities for Australia's healthcare system to improve outcomes. And I think one of the most recent and at the very least most well publicised examples of this was towards the middle of last year or late last year. I think it was as a result of the last federal budget, was the announcement of the nurse practitioner's role in the MS2 step medication. I don't know too much about this, I have to admit. So step us through this MS2 step, pardon the pun, and use this as an example, a case study, if you will, of the type of possibilities that the nurse practitioner role opens up.
If we go back to the 1960s, when our health insurance legislation was written, and our Healthcare Act is also ancient, that's the legislation we're still using today. And yes, there have been changes along the way, little tweaks and so forth. But if you think about nursing, since, the early 90s, we've gone into the university system. Our professions have really advanced. We're now a lot more autonomous or independent in our practice. We're doing a lot more, but the legislation is still very outdated, and, changes along the way have been made, but nowhere near enough. So end of the day, some very wise people have looked at MS2 step and said, well, you can only access it through very, very few. You've got very few options to access it in Australia because there's not many prescribers of it. And basically, people who make what is a very difficult decision to access something like MS2 step, if they can't access it in time, they end up having to go to hospital and have the surgical options. So, we make the decision at a very high level to include nurse practitioners and midwives as prescribers, as to groups who are already prescribing medications in Australia. Eligible midwives who have the appropriate qualification prescribe a number of medicines for women during pregnancy and postnatally, and nurse practitioners have very broad prescribing rights across the country, but MS2 step was not included in that. So when the decision was made not only to allow nurse practitioners and eligible midwives to prescribe it, they also, almost at the same time, very rapidly thereafter, decided that it would be funded under the PBS in the same way it would if a medical practitioner prescribed it. So this was all good news. It's now allowing more women to access this. It will open it up to timely access, which is very important when you consider what MS2 step's used for. And, and it's going to be funded, so there's equity there. So you don't get financially penalised if it's a nurse practitioner that you see about it or a midwife that you see about it. So it's all very important. fantastic decisions. But then we hit the barrier. The hard barrier is the legislation. So in every state territory in Australia, there is state-based or territory-based legislation that provides a barrier for prescribing of this medication. To my understanding, they're all having to review their local legislation. But even though the TGA and the PBS made those decisions last year, we still have not seen a prescription written by a nurse practitioner or a midwife in Australia because we have to change this legislation. In a nutshell, this legislation was written medico-specific. So what that means is that all other health practitioners are automatically excluded from being permitted to prescribe it. So across the board, and it's not just in regard to MS2-step, but across the board, what we're trying to do is look at legislation that affects healthcare and use terms like prescriber, authorised prescriber, start opening up to other health professions that since the 1960s have come a very long way and can do much more than what they were doing in the 1960s. And frankly, we need them too. Every profession has, drugs and poisons regulations that they have to abide by. So it's a matter of all the different types of legislation. They don't fit together. Their terminology is inconsistent. And what we need to do is look at consistency. It's kind of a systematic change that's come from a really good decision that does highlight from a broader perspective and bring it away from that medico-centric approach, which was used back in the 1960s and 70s. And, in some respects, too, it's about future-proofing so we don't end up in this position again in another 20 or 30 years. It's no good having nurse practitioner-specific legislation everywhere either, because we don't know how things are going to look in 30 years. And, we need to think about the future here. We've written ourselves into the biggest corner in the world with our Medicare regulations and the way Medicare is set up, so complicated. And, we don't want to go down those pathways in the future. We have to think about, and we also have to think about funding and how we can fund healthcare rather than fund health practitioners and, not making things so complex that no one can understand how it works.
Okay, well, the last example I think you wanted to share with us was more from your perspective in setting up and operating health services themselves. I think everyone will be familiar with what a general practice clinic is or a GP clinic, but tell us about the opportunities that the role of the nurse practitioner opens up out in the community health setting, such as that as well.
Ideally, it would be fantastic if GP clinics were able to incorporate a wide range of health professionals, including nurse practitioners. And we have great examples around the country of where nurse practitioners are working alongside GPs in clinics, and it's absolutely brilliant. But there's many, many blockages to that being able to work, and one is that nurse practitioners are not funded well. It's not financially feasible for a nurse practitioner to work in a GP clinic. It's certainly not feasible for them to bulk bill. It's costing those clinics money to have them there instead of at least paying their own way. There's also other issues related to funding. Nurse practitioners can't refer to some allied health specialists, like a psychologist. They can refer to them, but the patient doesn't get a Medicare rebate. So there's a few blockages in regard to funding that have seen a very poor uptake. And for decades, the main primary care model that we've seen in Australia is general practice. But as a nurse practitioner who owns her own primary care clinic, and many nurse practitioners around the country have forged their own path because there hasn't been another alternative, and also, frankly, many nurse practitioners have built clinics in areas of need where nobody else has actually wanted to build a clinic or been able to build a clinic. So we're providing services to communities, and we don't get any of those incentives. We don't get any of the funding that GP clinics get. So then we look at, what are the blockages to that? The fact is that, be funded by the government or to take government money in order to support service delivery, we really need to ensure that it's high quality. So we need to ensure that it meets standards. So if we go back to the general practice scenario, they've got great accreditation pathways. They've got accreditation standards. they've got a pathway, they can get accreditation, they go through an accreditation cycle and they can get the funding, but there's nothing for anybody else. There's no way for anybody else. So years ago, I was talking about alternative standards being needed. And to be honest, people look at me like I'm a bit crazy. Why do you want more standards? Why do you want to go through accreditation? But working a lot with the Australian Commission in Safety and Quality in Healthcare, there's now primary and community care standards for practices, and there's now an accreditation process. And while we haven't got that final link to the funding mechanisms or the incentive programs, we now have the standards, we now have the accreditation process for non-GP primary and community care services. So it's a great alternative pathway. And we can all talk about money and say, it's an option for people to get funding and incentives from the government. That's fantastic. You can also look at it from the consumer perspective, where they're now going to be able to look at practices that are not GP clinics and be reassured that they've met quality and safety standards. I think this is really important. But as I said, we just have that final link to make between extending those incentive programs to primary and community care centres that meet these standards. And once we can do that, I think we'll have much better access to care, equity and access to care in Australia. And you'll also see new and unique types of health services setting up in rural and remote areas. They might be nurse practitioner-led. And when we say nurse practitioner-led, I want to be very clear. We're not saying nobody else can come in. We actually would hope to see multidisciplinary teams developing in those centres. But until you have a healthcare service for people to work in, you're not going to see that developing. And it's nurse practitioners that are out there wanting to lead them. So let's enable that. I'm really excited for the future once we build that link between accredited practices and the incentive programs.
And the incentive program is primarily Medicare?
Medicare, but also very quality and safety focused. So if your practice is meeting certain standards, and it's sort of KPIs in a way.
So an outcomes-based type funding programs as well.
So a lot of it is outcome-based. So, more preventative care-based and providing evidence. What we want is health services that are, effective, efficient, quality, safe, that's what we actually want. So that's what we should be funding. It's not reasonable anymore to just fund one type of practice. Australia's a unique country. We are a small population across a very wide land, and we have very vulnerable groups in our communities, from a health perspective and in many other ways. And that requires unique considerations and different approaches in healthcare, and it's well past time that we got our skates on with this. And I'm really excited. I'm probably more excited about this accreditation process than anyone else. And I'm sure people look at me and shake their head and go, why is she so excited about this? But I actually see it's really what we needed to move forward. It is absolutely what we needed to move forward. It's all well and good to jump up and down and say, why can't I get this? Why can't my patients access that? But things need to be measurable. You can't just say, I get it because I'm good. You actually have to be able to demonstrate. So the accreditation process is that opportunity.
The impact that the innovative role of the nurse practitioner can have in driving change, catalysing innovation in the way that services get designed. And you touched on equity and access as part of that conversation. I think it's worth noting that the show is called Outcomes because Australia ranks number one in the world according to Commonwealth Health Fund's a report from them in 2021. But we rank number one for healthcare outcomes, but we actually don't perform as well on those other two areas that you mentioned, equity and access. Initiatives like this, the accreditation framework from the Hospital Accrediting Organisation, Australian Safety and Quality Commission on Healthcare. I think I got that right. Always a bit of a mouthful. But, it's just another example of the systematic change that a nurse practitioner can help drive in our healthcare system. So with that, Leanne, I'd really love to say a big thank you on behalf of all the listeners for sharing with us your experience. Keep going, keep fighting the good fight, so to speak. trying to drive this change. You're a real champion of that. And thanks for everything that you're doing.
No, thanks for highlighting it. It's I often get asked what's going on, why are nurse practitioners not everywhere? So, it's a great idea, obviously. But you know what? If we don't fit into the existing health system, we have to change it. And then that makes us look at the health system. And if the health system's not fitting needs, and like I just said, Will, the patients that do access our healthcare system, we're really good. We do a really good job. But the gap is huge for those that can't access it. So one change flows on to another, and we have to look at the whole lot. We can't just be isolated to looking at the nurse practitioner role. Like if ACMP was very focused on that, we would never get anywhere. So I actually consider it a responsibility.
A systemic change is the one that lasts the longest. So if that's the type of change you're producing, the legacy is going to be enormous, benefiting no doubt hundreds of thousands, millions of Australians in their healthcare for decades to come. So all the best with that. And I look forward to attending my first ASQHS accredited community health service, maybe towards the end of the year or next year, seeing what it's like.
Well, there's already some accredited under that process. So, keep your eyes peeled.
Keep your eyes peeled. All right. Well, fantastic. Thank you very much, Leanne.
Thank you.
You've been listening to Outcomes, a show about uncovering the hundreds of micro innovations that help make Australia's healthcare system one of the best in the world. This podcast is produced by AusMed, one of Australia's leading providers of educational content and software to the health, aged, disability, community and allied health sectors. To find out more, head to our website, ausmed.com.au. To make sure you don't miss an episode of Outcomes, be sure to subscribe to or follow the show in your favourite podcasting app. And while you're there, please leave us a 5-star review, as it really helps others to find the show. I'm Will Egan, and I'll see you next time for another episode of Outcomes.